Chapter 10. Okay, first, eh, first word is an angiography. Angiography is a medical imaging system which approach can reveal, say, trying to say something, can reveal the pattern of blood vessel. And it's done through X-ray. But to reveal a certain region of the area, you have to inject some reagents called uh, contrast reagents to enhance the contrast reagents. Reagents, yes. And then the image you get from this way, call it angiogram. And another thing, okay, angiocardiography. Angiocardiography, that's the same technology, but just focus on the heart and the blood vessels around the heart. So, say you can see now, angio means the blood vessels related to the blood vessels, and angio, angio are Diabetes. It's not a really common word. It's rare. It means widespread infection in the blood vessels and the heart. It's a rare disease, and the word itself is rarely used. But if it happened, I mean, it's very serious. It's not only a consequence of a sepsis, the systemic bacteria infection, and angioma. Angioma is in most cases, in all cases, it's a benign. It's a benign tumor that originates from the blood vessel surface cells or epithelial cell. And this cell we have special name called endothelial cell. So endothelial cell become a tumor called angioma. And the most common angioma is called cherry angioma. And you may ever see some, like there's red spots on the surface of the skin. And in most cases, there's nothing to worry about unless this angioma grows inside the brain. Because once the angioma burst, it can cause a stroke inside the brain. And let's see, angioscopy. So, blood vessel angioscopy, scoping. Look into the blood vessel. When you need to look into the blood vessel, it's commonly use a flexible camera getting this blood vessel like colonoscopy, and this is even smaller. And in many cases, it's look into the coronary artery. What is coronary artery? This is the heart, and this is the aorta. And before the aorta leave the heart, there are two blood vessels, arteries, supply blood to the heart muscle. And these two blood vessels are one of the most vulnerable arteries to atherosclerosis. So angioscopy in most cases to image, to monitor or diagnose what happened to the coronary artery. This page. What's next? Angioscopy and angioplasty. We talked about this in the first chapter 1. You can go back to this. Angioplasty basically using a device, an instrument to open up the narrowing blood vessel. And angiography, that means suture up the vessel, and like basically repairing, or for any reason we need to suture up the vessel. Keep going. And angiospasm and vasospasm. They are largely the same. Spasm means a sudden narrowing. The angiosperm and the vasospasm, both of those means a sudden shrink, contraction, or narrowing of the blood vessels. Let me see. There's a tiny difference. So angiospasm may reflect to all different types of blood vessels. However, the vasospasm mostly refers to the artery. And in our body, we have mainly 3 types of vessels: artery, vein, and capillary. So artery means from the heart to the tissue. Any blood vessel deliver blood outside the heart is artery. And then any blood vessel return blood back to the heart is a vein. And the capillary are the small vessels very deep in the muscles. We'll further discuss this later. And cardiovascular. Cardio means the heart. Vascular means the blood vessel. Cardiovascular related to the heart and the blood vessels. Okay, next page. Rhythm, arrhythmia, arrhythmia. No, rhythm, no rhythmia in the blood heart. It means irregular rhythm, irregular rhythm, irregular rhythm of the heart, or irregular heart. So normally we have 60 to 100 heart beat per minute. And if it's lower than 60, we call it bradycardia. More than 100 is tachycardia. And you see, yeah, it's a bradycardia, and both of those are type of arrhythmia. And the most common size of arrhythmia is the actual heartbeat, which is also called a premature heartbeat, which normally nothing to worry about. The most dangerous thing of the heartbeat is called fibrillation. Do I have that here? Yeah. Fibrillation. Fibrillation means theoretically all heart muscle cells should be beating synchronized. If they do not beat at the same time, then no blood will be pumped outside the heart at all. And fibrillation is the loss of synchronization of the heart beat, which means the heart basically lost the function of pumping the blood. Okay, we keep moving. Myocarditis. Again, inflammation. What's inflammation? Myo means muscle. Card means heart. Heart muscle inflammation. What can cause heart muscle inflammation? In most cases, again, it's autoimmune attack. But this attack can be triggered by cold or flu. That's one of the reasons because the virus that causing the cold or flu has some similarity of the heart muscle. So basically our immune system they recognize a good guy as a bad guy and attack to the heart muscle. That's the myocarditis. And cardiomyopathy, pathology, heart muscle pathology. This is another broad term to describe most of those heart muscle disorder, and many of those can relate it to heart failure. Heart failure is a disease that is different than heart stroke. This is all a heart fracture. This heart failure means the heart muscle can no longer beat or pump the blood as it supposed to be. Okay, so next, phlebitis. This is mainly related to the vein, inflammation of the vein. And let me see. Phlebitis means theoretically means any inflammation in the vein. This can be caused by infection or can be caused by accumulation of the blood. However, in practically, phlebitis mostly refers to superficial vein inflammation. We also call it deep vein inflammation, called deep vein thrombosis, which we'll talk about later. Is theoretically it's type of phlebitis, but it's it's the consequence and the cause is different. So in so many cases, when we talk about phlebitis, means superficial vein inflammation. We'll talk about this later. And let's see. Phlebotomy, open up, cut, or inject or open the vein. Why you want to open the vein? Draw blood. So phlebotomy in most cases, this means the procedure to draw blood. Polyarteritis. In most cases, it's written as polyarteritis. It's rare, but it's very serious. It's autoimmune disease that the body's own immune system attacks mostly mid-sized arteries and sometimes also small arteries. So It's, yeah, that's it. That's real. It cannot be cured and can be controlled but never be cured, and also very hard to diagnose because it's similar to the symptoms similar to other conditions. So polyarthritis. It's let's keep moving, keep moving. Okay, the next one is arterial. Arterial. It's a arterial is compared to artery. Both artery and arterial are delivering blood from the part to the tissue. And how to distinguish artery and arterial? First thing is both artery and arterial are artificial or a definition that proposed by human. In the body, there's no clear line basically between artery and arterial. However, artery are bigger. Basically, anything you can is visible by a bare eye, those are arteries. And then artery become dividing. When you get out of the heart, in one part is only the aorta. The aorta is the biggest artery, and then keep dividing into relatively smaller artery, say hepatic artery, coronary artery. And again, all of those arteries that still visible to eyes the artery. And then they further divide and become smaller vessels get in the tissue when you can no longer see them. And definitely there's no many of the arteries have their own name. When you cannot when you can no longer see them and then they do not have their own special names, they become artery. And then an artery first divided into capillaries. And what's the difference between the capillary? Capillary one, no, it's the so the difference between the artery and the capillary is that in artery there's still smooth muscle, and this smooth muscle can contract or relax to control how much blood get into each tissue. It's very important. Is a key component to regulate the blood supply and also the blood pressure. And there's no blood vessel in the capillary. Capillary has only one layer of cells here, and to facilitate the matter exchange. So that's the artery. And arterial rhexis. That means the rupture of the artery by maybe caused by injury, but in many cases by increased blood pressure and weakened the artery wall. And arterial sclerosis, which we discussed before, is forming a plaque. This artery, the plaque is here beneath the endothelial cells. It's already mentioned in chapter 3. And aortic stenosis. Stenosis means narrowing. And what causing the aortic stenosis? In most cases, because the valve. So this is the this is the left atrium, left ventricle, and this is aortic. So the blood will go only in one direction in the heart and the artery. And so the This like two gates can only open in one direction. This is called the valve. And the valve, if they cannot open fully open to allow the blood to pass, they cause the narrowing down of the aorta, because aortic stenosis. In some cases, the patient need a surgery to replace the old malfunctioning valve to increase the heart function. Okay, let's keep moving. Now this is the open new page. Now we talk about the atrium and the ventricle. To better understand the atrium and the ventricle, we have to draw a heart. So this is a heart. This is a valve. But this is the so I'm trying to draw a heart muscle here. This is a heart muscle. Heart is enclosed with heart muscle here, and very sick on the God. So this one, it is the right side for you, but think about a person lying there. This is the left side of the person. This is the left side, and this is called left atrium. Left atrium receive the blood from the left, and the right lungs receive the oxygen-rich blood, and then deliver to the left ventricle. The left ventricle, you see the muscle layer is the strongest chamber of the whole heart, and then it deliver the blood into the aorta. And the aorta, they deliver all the blood getting back to here, the right atrium. And when it get into all the tissue, the oxygen is gone, and so when it come back to the heart, it is the oxygen poor blood, and first get into the right atrium, and then go into the right ventricle, and then right ventricle get blood. This is called pulmonary trunk, and then pulmonary artery. When the artery deliver all the blood into the lungs by oxygen. This is the heart structure. Yes, good. Like, and next we talk about the blood cells. In the blood, there are different type of cells. Leukocytes means the white blood cells. They are the same word, and they are using interchangeably. Leukocytes mean white blood cells, and then leukopoiesis. Leukopoiesis means the process of generating the white blood cells is mostly happening in the bone marrow and lymphocytes. So leukocytes can generate different. There are two types of leukocytes. One is lymphocytes. The other is myelocytes. And so, like neutrophil, basophil, etc., etc. The other part, and then one branch of the leukocytes is the blood immune cells that associate with adaptive immunity. For example, B cells. And B cells generate antibodies. Antibodies are part of the adaptive immunity. And T cells and natural killer cells. So mainly there's two types of lymphocytes, B cell, T cell, natural killer cells. And lymphoma, leukemia. So these cells in the bone marrow, these cells develop in the bone marrow. At the beginning, there's a called hematopoietic stem cells. In some cases, we just call them blood stem cells. And then, if you follow the line, hematopoietic stem cells can become the lymphocyte progenitor, who will become all lymphocytes. And then some lymphocytes become B cells. This is one of the line of differentiation. Why I draw this? If some cells become cancer cells before it becomes lymphocytes, then this kind of cell can generate all type of leukocytes. And this is leukemia. We mentioned before. This is this is one type of the blood cancer. And then if lymphocyte progenitor, before it becomes any of those B cells, T cells, if they become cancer cells, then this is lymphoma. And then B cells can further divide into different cells. One of those is called plasma cells. Plasma cells are those cells produce a lot of antibodies. If the B cell in the tract to plasma cell become a cancer cell, and this is called myeloma. All these are the major three types of blood cancer. All of those are very dangerous. Okay, so lymphoma, leukemia, myeloma. Angiogram. This is basically the same as angiogram, but it look into the lymphatic system, lymphatic ducts. In our body, we not only have the blood vessels, but also we have lymphatic vessels. And lymphatic vessels, how to image lymphatic vessels using lymphangiogram. And why we need them? Some cancer will spread themselves through the lymphatic vessels. For example, breast cancer can spread themselves through the lymphatic vessels. So we go through measuring the lymphatic vessels can discover whether the cancer has been spread out. Okay. Okay, let's get a new concept. Hemopoiesis, generating blood cells, and most specifically red blood cells in the region. Red blood cells, in many cases, we just call it RBC, and platelet. Is that E? Yeah, platelet. our red blood cells platelets generation of hemophoresis, and then you breathe OAC, then it's only just the function to the process generating red blood cells, and you breathe OCYTOPENIA. It's a long word, actually means anemia. Same word. So hemocytopenia. And the deficiency of any blood cells is a broader than anemia. It can also cause the absence of platelets and white blood cells. Okay, next one. So thrombocytes, it means platelets. It's again, it's not necessarily thrombo. If you say thrombocytes, you're more knowledgeable than you say let's say platelets. If both are using an actually normal, we just use platelets. And thrombo and body. Okay, let's get a new page to talk about this one. So, yeah, body. Thrombo means blood, embolism. What does it mean? And so this is potentially very dangerous. This is one of the things we just mentioned before, but deep vein thrombosis. Firstly, this thrombosis should not appear at the beginning, at the first place. Why people have to it mainly happen in the vein of the leg. So this is the leg. Now you have some of those thrombosis or blood clotting happen here. Why happen here? In some cases, you just stand there for too long, and because they reduce the blood vessel rate, they develop the blood clotting. And what happened next? It stays there, it's fine, but in some cases, just detach from the vein and going back to the heart. So now let's draw the heart. So what I'm drawing here is the right atrium, right ventricle. This one will go all the way first to the right atrium, and then here, so here, and then after the right atrium, what does it go? It go to through the pulmonary trunk, it go to the lung, go into the lung. And then what happens is those are blocked heart and they block the lung. The lung no longer can receive any blood from the heart. So what happens if the lung blood circulation is blocked? The people can no longer get oxygen from the lung. So this is potentially a very dangerous situation, a potentially lethal situation happening here. Okay, so next, hemostasis. Hemostasis. Stasis means stop. No. It just means stop bleeding. And how to stop bleeding? They're mainly, so let me draw, say, this is a rupture here. And the first step is you have angiospasm. If the blood flowing this way, the blood vessel contract to reduce the blood floating, and then bring it, the platelets come to block the rupture, the blood vessels. However, this block, just imagine you use some kind of bricks to block a hole. It's loose. So the last step is that one is called a fibrin. Fibrin you serve as a glue the platelets together, eventually to stop the blocking, the blooding. And then this called coagulation. And coagulation happens in multiple steps. It has multiple proteins that involve, collectively called coagulation factors. And all of those coagulation factors are very important. And some people have the deficiency of the coagulation factor 8, now let's say as this, or 9. So people with a genetic deficiency of 8 call it A, and 9 is B. So hemophilia, some people may heard of it, is a kind of a royal disease because only in the royal family, because those families married to very close relatives. However, please keep in mind, many people in this world have hemophilia, and they are not, as a consequence, married close relatives to each other. It's just bad luck. They have the hemophilia, and they have the very bad internal bleeding problem. And it's in some cases it may be very dangerous because internal bleeding can cause death. So, and luckily there's a gene therapy who has recently, I think they developed by the Philadelphia Children's Hospital. At least for hemophilia B has a gene therapy now, and hemophilia A is under research. Anyway, now we have much better approach to treat this disease. And at the same time, coagulation is something that's very tricky. We need it, but we do not want too much of those. If you have too much of those, you have stroke, ischemic stroke. So to treat ischemic stroke, sometimes also use anticoagulants to prevent not only to prevent the stroke formation, but sometimes even try to dissolve the blood clot. Use like heparin and warfarin. Warfarin, something. Yeah. And okay, so last one, spleen. It's coming out of nowhere. Splenomegaly, a big spleen. What can cause a big spleen? Many different diseases. Anemia, liver diseases, in some cases, Gaucher diseases, all of those are big spleen. The big spleen itself is not an issue. As we mentioned, big liver and, a big liver, what else? Anyway, those big organ itself is not an issue, but it may reflect something that happened. It's behind the mechanism. So yeah, that's it.